Now, one thing I have to say, which is important, is that how we make sure that we defend Medicaid. You know, it's interesting. When you hear a 33% cut in Medicaid, you have to think, well, what exactly does that mean? But here's one statistic that's worth taking home with you. If you cut every single poor child from Medicaid, all 30 million, you cut all of them, you would only reduce the Medicaid budget by 21.5%. So remember, they're going to reduce Medicaid by 33%, and you would only get 2/3 of the way there if you cut off every single child. Now, to me, that should be the end of the conversation. That should be the end, just from a moral, from a humanitarian point of view, from a spiritual point of view, from many religious point of view. You would just not seek to reduce the deficit so deeply on the backs of children who are impoverished. But the reality is that because you can see that the children are only 21%, it also forces you to recognize something else, that Medicaid is not just a program for poor children or poor Americans. It is a critical part of the safety net for middle-class families across this country. You are the experts, you know. I've had people say at times, the president, should the president use the example that if Medicaid was cut by 33%, that it might mean that hundreds of thousands, millions of families who have a child with autism or Down syndrome could have their health coverage reduced? And my response is, how can you not make that point? Those are the optional coverage of Medicaid. They would likely be the first to go. We know that 2/3 of the cost are from helping to care or helping to provide health care for people with serious disabilities or have a child with serious disabilities, or for families of all income brackets who have to have a parent or grandparent go into nursing homes. So I wish that it was just enough to say that it would hurt poor children and that would be the end of the discussion. But if we really want to protect Medicaid, I think we do have to explain, and I think we've done a good job and a better job of explaining that it is critical to Americans across the board, middle-class Americans, any family that has a member or child with serious disabilities. And I think that the more we have made the case of how integral this is, the more we have put up the protective barrier against those who would decide to slash it, not because it's the right thing to do, but because they think it's the politically easier thing to do. And I think every time somebody thinks it's a politically easy thing to do to cut and go after Medicaid because they think nobody will care, because they think there aren't people who will advocate and lobby against them when they try to leave alone those with privilege and try to cut Medicaid, it is incumbent on all of us to let them know they are wrong. Now, I also want to tell you that the price of ensuring that you are protecting Medicaid is not easy, because we do have a deficit problem and we do have to make tough choices. So we've made a tough choice recently. We used to have not the $830 billion of Medicaid savings that the House Republicans did, but we used to have about 1/8 or 10 or 11% that amount, $100 billion or so. But we have come to believe that it is not the time to make even those savings. Not when this is the critical moment in implementing the Affordable Care Act. We believe at this historic moment that it is very important to let Democratic and Republican governors know that if they will do the right and just and economically smart thing for their state by taking the Medicaid expansions in the Affordable Care Act, that they should do so with the understanding that the rug will not be pulled out from under them, that they will not make this step and then find later that Medicaid is the first place or even the last place people are going for serious deficit reductions. So we have made you will see in our budget, and we have made very clear to the Republicans as we have negotiated that we are not going to be willing to accept even the Medicaid savings that we had once put on the table. We feel the world has changed with the Supreme Court decision, and because of that, our policies are being affected. And so I said this to a group of bipartisan governors yesterday. Medicaid is not, other than the most minimal, smart, efficiency type of measures, Medicaid savings, Medicaid cuts for this president, for this administration, are not on the table for the round of deficit reduction coming up.